Good evening, everyone. Welcome to another one in our webinar series here at Whole Health. This one is just for us. There's no broadcast on Facebook Live. So this is just internal to our own organization. So tonight, of course, the topic is pneumonia. And what we're going to do is we are going to split the presentation into a couple of different ways. We're going to talk a little bit about education around pneumonia. Before we talk about workflow and the opportunity around this great program that Tiana has put together in collaboration with Pfizer. So just before we get going, a little bit of housekeeping. If anybody has question tonight, or even right now, if I think we're in a good spot from a logistics perspective. I'm hoping everyone can hear us, and I'm hoping everyone can see the slides. But if you cannot, or we're having any problems related to that, please use either the raise hand function, which is on the participant screen, or just go down into the chat function, because we do have Lily is going to be monitoring the chat function throughout the presentation. So go to the next slide. To get us rolling, I've already mentioned them, but this program was made possible this year again in 2019 from our friends at Pfizer. So we're very, very grateful for the opportunity that they've given us, and we're going to maximize it as much as we can. I'm confident of that. Just next time you see someone from Pfizer at a function or whatever, make sure you go up there and give them a big smile and say thanks. So Tiana, the agenda tonight.
Yeah, so Dean touched on this a bit already, but we'll start with the general pneumonia overview, and then we'll go more into protecting your patients and what the role of the pharmacist is. Then we'll move into pharmacy integration and seeing how all members of the pharmacy team have a role to play in optimizing immunization, specifically pneumonia vaccines. And then the last part, we'll briefly go over our pneumonia program for Whole Health for 2019. And to kick it off, we'll just take a look back at last year's successful campaign.
So once again, November is not only a month where pharmacy participates in flu and flu vaccine, but it also is the month that has World Pneumonia Day in it. And this year it is on November the 12th. So the timing is good. I mean, everybody's thinking about vaccines. Everybody's thinking about, with winter coming, how do I protect myself as best as possible? So that's really kind of what we're going to be focusing on our efforts on tonight. And Tiana, like I said, is going to go over that. These are just some happy snaps from last year. World Pneumonia Day last year, I think, was the 14th of November last year, and we had some great participation. We do know that a lot of our stores are already well underway. We've got some great pictures and feedback so far, so I think we're off to a great start.
Yeah, and in World Pneumonia Day 2018 in our campaign last year, we did see good increases in protection of our patients against pneumonia through immunization. And that's something that we're seeing continue on in the beginning of 2018. And beginning of 2019. And we want to continue to build on that momentum, especially as those winter months come, and really ramping up pneumonia vaccine and vaccination in preparation for potential onset of pneumonia, following a lot of flu cases in the 2019 year. So first I'll talk about pneumonia just in general. So some of you might have seen pneumonia quite a bit in the news these days. Oprah was recently on the Ellen DeGeneres show talking about her experience with, unfortunately, a case of pneumonia. And we'll watch a quick clip of this so you can see what it really was like and how severe it was even in Oprah. Okay, it looks like, sorry, it looks like we're having just some audio issues with the video.
Oprah talks too much anyway, so basically she's told us that she recently had pneumonia. It was very severe. She was hospitalized, and
she's encouraging everyone to get not only their flu shots this year, but their pneumonia vaccine.
And when was that, Tiana? That was on about a few weeks ago?
Maybe a few weeks ago.
On Ellen? Yeah.
Okay. Okay, so if you're not as big of a fan of Oprah as some people are, we do have pneumonia in the Canadian news, so beyond Oprah. So we know that deaths from pneumonia have been increasing, and even emergency room visits have increased according to CIHI in recent years. And so it is a disease that's impacting Canadians significantly. And when we look at pneumococcal pneumonia, we know that it's a serious bacterial infection caused by Streptococcus pneumoniae. And there are certain common serotypes, specifically in Canada, that have been seen when studies analyzed patients who are hospitalized for pneumonia and looked at what grew in their cultures. So as you can see in blue, some of the really prominent strains for severe pneumonia, which would result in hospitalization, were ones like 19A, 7F, and 3. And we'll talk about this a bit later, but the ones that you see here in blue are the serotypes that are covered by Prevnar. And then when we see the orange, those are additional strains that are covered by Pneumovax. And then the gray ones are ones that aren't covered in current vaccines. But what we can see is that those serotypes that are serious and are prevalent are covered in the Prevnar vaccine. So we care about pneumonia. Not only is it leading a lot of Canadians to be hospitalized, but it also results in complications. So common complications that you might already think of are lung and kidney complications, but one really surprising one is actually heart complications. So there ends up being an increased risk of things like heart attacks following a case of pneumonia, and the risk remains elevated for years. In addition to that, there is the risk of death. So in patients who are hospitalized, about 1 in 4 patients who end up going to the emergency department for pneumonia are hospitalized, and then about 10% actually end up dying in hospital. And this number increases for people who are older, so the 65 and older crowd, that ends up being about 15% and above end up actually passing away from pneumonia. So it is something that's very, very serious. Some signs and symptoms of pneumonia to keep out for. There's some general malaise, so things like fever, nausea and vomiting, sweating and shaking, chills, and then fatigue and confusion. But then there's some signs and symptoms that would kind of steer you more into the pneumonia thinking. So that's things like cough with phlegm, a shortness of breath, really chest pain, fast breathing, and even a fast heart rate. So if any of your patients come into a community pharmacy with these symptoms, especially the bottom line, that's when we'd want to refer to a physician or even to a hospital in some high-risk populations. So who is most at risk? So like we often say with a lot of diseases, children under 5 years old are at risk, and adults over 65 years. So that's any adult who's over 65 years old is at risk, and that's regardless of if they have other conditions. Now, in adults, even 50 years and above, they can be at risk as well if they have other medical conditions. And some big ones to focus on are things like lung conditions, so emphysema, asthma, COPD, heart conditions like heart failure or past heart attacks, and diabetes. And in addition to that, there's lifestyle causes, so adults 50 years and above who smoke or who have alcohol use disorders, and those who are immune compromised. So any patient who's on a biologic, is HIV positive, or has cancer, they would also be at high risk.
And so this will be the first time tonight you kind of hear this message, but we're going to talk a lot more towards the end of the presentation about the opportunity for our pharmacies in this program. But it's the first time you'll kind of hear. This is the first slide that identifies the patients that you really should talk to as pharmacists about this. So I'm not going to dwell on it on this slide, but we're going to get to it on a later slide in a lot more detail.
Okay, so how do we as pharmacists and as pharmacy team members, like assistants and technicians, protect our mutual patients? In terms of immunization, pharmacists' scope of practice includes immunization. So in Alberta and Ontario, as long as the patient is 5 years or above, we can immunize them if we're injection certified and have valid and up-to-date first aid and CPR. In Alberta, any vaccine can be given, and in Ontario, influenza as well as 13 vaccine preventable diseases can be given. And pneumonia and the pneumococcal vaccines fall within both of these. So pharmacists in both Alberta and Ontario can administer both pneumonia vaccines. Now, there are 2 pneumonia vaccines available on the Canadian market. There's Prevnar, which is a conjugate polysaccharide, and that's really important. So we'll get back to that again in a few slides. In addition to that, there's Pneumovax, which is a much older vaccine. It's been around a very long time, but because of that, it is a polysaccharide vaccine, and there are some shortfalls to that, which we'll touch on. So a lot of people know Prevnar is Prevnar 13, Pneumovax is Pneumovax 13. So that relates to the number of serogroups that are covered. So you can see here in red, so 6A is the serotype that only Prevnar covers. And then there are serotypes that both Prevnar and Pneumovax cover. So 1, 3, 4, 5, 6B, 7F, 9V, 14, 18C, 19A, 19F, and 23F. So those are where we have both coverage. And if you remember from earlier in the presentation, we really see some serious hospitalization from serotypes 19A, 3, and 7. And then we have additional serotypes that only Pneumovax cover, which you can see at the bottom row here. So on first glance, you might think, well, Pneumovax has the most, so it must be better. And while having coverage is important, there's other things to consider as well. And so one of those is the fact that Prevnar is a conjugate vaccine. So when we look at conjugate vaccines, Immunize Canada has said that they result in more robust antibody responses, so you have a better immune response. You also have longer protection because of the B-cell response that's generated, and so you have more immune memory, and we don't see the same waning of the protection that we see with a polysaccharide vaccine. In addition to that, conjugate vaccines actually work in terms of herd immunity. So a lot of streptococcal pneumonia colonizes people in the nasal passages, and conjugate vaccines actually get rid of that colonization, whereas polysaccharide vaccines don't, and so they don't have a role in herd immunity. One really interesting thing that we're starting to see actually is when we give young children a Prevnar vaccine, because it prevents the colonization and addresses that, we're not seeing as many cases in older adults because of that herd immunity. Now, there are even additional benefits to receiving both vaccines. So if you receive both the Prevnar and Pneumovax vaccine, not only do you have those benefits of the conjugate vaccine that we talked about, but you have a greater immune response, and you have additional strain coverage like we saw. So this shows you that slide, that additional immune response. So I'll walk you through this slide here, but when we look at people who have received just pneumovax, which is the line in green here, we can see that it's a lower immune response. It's actually the lowest that's on this graph. Whereas when we look at people in the same age group, so 60 to 64 years old, who first receive Prevnar and then receive pneumovax, so that's the red line here, it's quite a bit higher in terms of the immune response, and it increases dramatically higher as well.
Just to reiterate what Tiana was saying, there's a dramatic difference between the response on pneumovax versus both vaccines together. But when you look at Prevnar, which I believe is the blue line, correct, Tiana?
Yeah.
There's not that much of a difference. Like it's a significant change in sort of the immune response around pneumovax versus Prevnar. So just pointing that out on the graph, because it's probably a little bit hard to see, but the bottom line is the green. That is the immune response around pneumovax. The combined pneumovax and Prevnar is the dotted red line. But right below that, you'll see that blue line, which is by itself Prevnar. So quite a significant difference in the immune response.
Yeah. And now hang with me here, but we're going to go over the public coverage, and then I'll break it down in the next slide to really show, okay, who do we need to address most because they aren't publicly covered. But when I think about public coverage for pneumonia, I like to think of it in terms of high-risk patients and then at-risk patients. So a high-risk patient, in my mind, is someone who has immune suppression. So that's someone who doesn't have a spleen, is HIV positive, who has cancer. Those would be high-risk patients. And those patients are covered publicly for Prevnar and for pneumovax. And that's in Ontario and in Alberta. When we see a difference in terms of public coverage, it's more for the at-risk patient population. So people who are over 65 and those who have chronic medical conditions. So in Ontario, those patients are eligible for publicly funded pneumovax vaccine, but they aren't eligible for publicly funded Prevnar vaccine. So that means that patients who have things like cardiac disease, diabetes, liver or kidney disease, those patients are still at risk because they don't have the publicly funded Prevnar vaccine. And so we've broken it down further here into what is the role for pharmacists in addressing these patients who remain at risk based on publicly covered vaccines. So it's again those adults 65 years and above and adults 50 years and above with chronic conditions. And the lung conditions, diabetes, heart conditions, liver or kidney conditions, and individuals who smoke.
So for the second time in the presentation, and again, we'll mention it one more time before the end, this is really your opportunity in your pharmacy. And just keep in mind that this program is unique to us. We've worked with hand in glove with Pfizer on this, just as we did in 2018. But really your role and the role of your pharmacy teams out there are to look at these two groups, right? Adults over 65 and those adults that are over 50, but they've got a chronic condition. So these are at-risk people, and this is really the opportunity for you in your pharmacy to focus in on these folks to talk about, pneumonia, because up until now, I mean, I think a lot of people just kind of took pneumonia for granted. Oh, it's fall time, I have to get a flu shot. But the big focus here is really to sort of start talking pneumonia with a lot of these patients. We all have them. Anywhere from probably 30 to 60% of patients coming into your pharmacy are those over 65 years of age. Those are the ODB patients. So that is a great group to kind of focus on for this program. So
yeah, and one of the things you can do is proactively identify these patients and really fill out something like a pharmaceutical opinion form to get that prescription and to get that vaccine in the works for them. And then if it's a patient who is high risk and has publicly covered Prevnar and Pneumovax, that would be someone who you more refer to their primary care provider, since they can get the publicly funded version outside of a pharmacy. Okay. And so now we'll talk about how to integrate immunization into the pharmacy workflow. So there's 4 key steps to this. The first one is to proactively identify eligible patients. The next is to address patient hesitancy, then assess immunization status, and lastly, administer vaccine or vaccines. So we'll go through that together. So all members of the pharmacy team should really be involved in proactively identifying eligible patients. And like we talked about, there's really 3 main groups that we can address. The first is based on age, so individuals 65 years and older, and there might be some hints that this is your patient. First, you could obviously look at their profile and see that they are 65 years or above. The next, and this might be a big role for pharmacy assistants and technicians who are having conversations with patients, and they might hear like, oh, we're planning on retiring, we're going to go south. Those kind of conversations can be a good sign that, hey, we should get these people immunized before maybe their private coverage runs out. And another one is when people hit their 65th birthday and they might start being ODB eligible as seniors. That's obviously an indicator that they now are at high risk of pneumonia. Another one is those medical conditions that we touched on. So noticing when people are filling a prescription for an inhaler or picking up an aero chamber, that can be a great sign that they have asthma, COPD, emphysema. Noticing someone who's using the blood pressure machine, that can be a great indicator that they have maybe a past heart attack or heart failure. Patients who are picking up new glucometers or filling a prescription for insulin, that could be an indicator obviously of diabetes. And then if you notice that medications are dose adjusted, either renally or for hepatic reasons, that's also an indicator that they're at risk for pneumonia. And the last one is lifestyle. So again, a big role for pharmacy assistants and technicians. They might be the first ones to notice that the patient is picking up something like nicotine replacement therapy. And that would be a great indicator that they are currently smoking and are at risk for pneumonia and should be immunized. And again, the last one being an alcohol use disorder, if maybe they've disclosed that in a social history with you. Now, once we've identified these patients, the next step is really to address any vaccine hesitancy, because often it can be overcome. Now, one of the big reasons for hesitancy might be a financial barrier. So some points that might help with this conversation, patients who have private plans, about or over 50% of patients who have private plans actually have vaccine coverage through the group benefits of that plan. In addition to that, if a vaccine isn't covered as part of that member's plan, or it isn't entirely covered, about 33% of individuals with health spending accounts actually have vaccines as an item that can be used for that pool of money in the health spending account. In addition to that, patients who do have to pay out of pocket, they can use their pneumonia vaccine as part of a claim in their medical expenses for their tax return. And then lastly, there is public coverage for those high-risk individuals that we talked about, and those as part of the routine immunization program, so Pneumovax for individuals 65 and above. Another reason for hesitancy could be that there are unknown benefits. So putting it into perspective for the patient. So letting them know that just like seatbelts, vaccines are a public health initiative, and they're actually the #1 health initiative in the last 50 years. It's saved the most lives. It reduces risks and complications for pneumonia. And getting both vaccines offers that additional strain protection, but having Prevnar immunization gives you a greater immune response and that longer lasting protection. So things to really emphasize in terms of the benefits of Prevnar. And the last thing that can help, and there have been studies on this actually, is how we make the recommendations. So for patients who are uncertain, having a pharmacist or healthcare provider make the recommendation and making a strong, confident recommendation can really go a long way in terms of that uptake of the immunization. And one key thing is also highlighting that the vaccine can be given the same day by the pharmacist, rather than having them return or asking them to return, because they might get lost in the system if that's the case. The next step is really to assess the immunization status. Again, a role for everyone on the pharmacy team. That could be inquiring with a family doc or nurse practitioner for an immunization history, a public health unit, or even an employer and insurance claims. The next step is assessing what vaccines have been given and what's outstanding. And there's a good opportunity to assess all adult immunizations that the patient might be eligible for. So yes, assessing pneumonia, but you can use that opportunity to also give them their influenza vaccine, their shingles vaccine, and anything else they might also be eligible for. And the last thing is to make a recommendation. So based on if they've received a vaccine previously or not for pneumonia, that'll change your recommendation. So ideally, to get the best immune response, we want to give Prevnar first and then Pneumovax. And we need to wait 8 weeks between Prevnar and Pneumovax when Prevnar is given first. And that's because of an immune blunting that occurs after you give a pneumonia vaccine. In the case that the patient has already received a Pneumovax vaccine, we still want to give them a Prevnar vaccine, but we have to wait a full year. And this is because Pneumovax blunts the immune system to a greater extent. So we have to wait for that year to finish for the patient to get the full benefit of Prevnar afterwards. Okay, and the last step is to administer the pneumonia vaccines. So some things to remember are that pneumonia vaccines are Schedule II, so they can be given without a prescription, although some private plans require prescriptions for reimbursement. So depending on the patient's situation, it may or may not be needed. They're stored in the fridge, and they have a very long shelf life. So I actually checked with McMahon to see what their current inventory shelf life is, and the single dose of Prevnar actually expires in September 2021. So you've got 2 years to give that vaccine, and I'm sure you'll encounter a patient who has these at-risk or high-risk criteria by then. The next thing, like we talked about, is optimizing the encounter. So it's okay to get multiple vaccines on the same day. Ideally, you'd use a different injection site, so maybe the right deltoid and the left deltoid. If they're getting 3 vaccines on the same day, you can use the same site, but try to separate the actual injection site by about 1 inch if possible. There is some questions that come up about how long do I have to wait after receiving a live vaccine. And after receiving a live vaccine, you have to wait 4 weeks before giving another vaccine. So a key example is Zostavax. If the patient received a Zostavax vaccine, you'd have to wait 4 weeks before giving them Prevnar. However, if they got a shingles vaccine like Shingrix, that's not a live vaccine and you wouldn't have to wait. Immunization at any point afterwards would be okay. And the last thing is follow-up. So if you had the conversation with your patient and they said, you know, I actually just got my Pneumovax vaccine, adding a reminder, a pop-up into your Philware or Kroll software to trigger the conversation in a year's time would be a really good idea. And then following up with patients who did get the vaccine to see how it went and to inform their nurse practitioner or their family physician to really close this circle of care and make sure that strong relationship is maintained. Okay. So by now you've all received the pneumonia campaign materials in the mail and via email. If you haven't received any materials, do send me an email at tiana@wholehealthrx.ca and we can get you those materials. This is an overview of the materials, so the toolkit that you all received, and it includes new adult immunization posters. Those are the 18 by 24s, pharmaceutical opinion templates for pneumonia and shingles to help with proactively identifying and procuring prescriptions for these vaccines. Patient brochures and 10 cards, which can really help the patients who might want to think about it and learn more and read independently. There's some social media content for you to use on Instagram, Facebook to really get the word out and maybe even get additional patients and to help you differentiate yourself from other pharmacies that are out there. And some World Pneumonia Day components. So things like our buttons, our prescription bag attachments, and our countertop displays to really start having the conversations with patients and act as a bit of a prompt. And then lastly, for anybody who requires additional pharmacy materials, we have our updated flu consent form where patients are screening themselves for pneumonia, shingles, and meningitis. So you might have to address their requests for additional conversations. We have the NACI Bridge Cling, which reviews the timelines for immunizations because it can be a bit confusing, the 8 weeks versus 1 year. And lastly, we have a counseling guide for both pharmacists and pharmacy technicians and assistants. So some points on some frequently asked questions and ways to integrate the conversation into your everyday workflow. If anyone's looking for additional resources on how to have that conversation with patients, Pfizer does have this resource available, which we'll also add to the partners portal. And it goes over things like what vaccines are recommended, what's the evidence for pneumococcal vaccines, and how do I really communicate with patients regarding immunization and supporting information. Okay.
So with that, we're going to open it up for questions shortly. Just some final comments. I think we've put together a great program here, and I think the key word, Tiana, is campaign. Yeah. I mean, this is a campaign you guys can do at your pharmacies in your communities. It's easy, and it's something your whole pharmacy staff can get behind. We've made some recommendations, certainly about the amount we think you should order or bring into your pharmacies. As Tiana said, we've checked, so we can't use no one can use the excuse that it'll expire quickly. So we've got good dating as far as the expiry dates on the products through McMahon. And remember, I mean, the opportunity here is with those at-risk patients, right? So it's those people that are over 50 that have chronic conditions, but it's also seniors, those over 65, and we know that we have a lot of them in our pharmacies. So that's the opportunity here, everyone. Obviously, we're very grateful to Pfizer for helping us create this program. I think we've shown you clinically the advantages of Prevnar as a product, I think with that, I think we'll just open it up for questions if anybody has any. Tiana, how is this going to be available after this program?
Yeah, so we did record the presentation, so I'll send out the slides to everyone so that they have a copy via email, and we'll also update the partners portal with the recording so that you can view it there as well.
So we did have a couple of questions. One was, can we give without a prescription?
Yeah, so Prevnar and Pneumovax are both Schedule II vaccines, so they can be given without a prescription. If the patient's publicly covered for the vaccines, then instead of filling it and giving it, it's best to refer, and they can get it from public health directly. If they have private insurance, and that'll be covering it, you might want to check with the specific private insurance to see if they require a prescription in order for it to be covered. but you could give it, especially in a patient who's paying out of pocket, you could give it same day.
Yeah, I think generally speaking, I mean, here in Canada we have thousands and thousands of different plan types, depending on sort of the employer and whether you're with Sun Life or Manulife or so there's a ton of different variables around private coverage. I think from what I know, private plans are starting more and more to cover vaccines, but certainly that is something it's going to be very, very individual per patient and per patient's family. So can't really answer the question about coverage, in a very black and white way, but certainly you can investigate that at your pharmacy. So.
Yeah, and one of the patient pamphlets that we sent out to each pharmacy is specifically on insurance coverage. So one of the things you can do is have those available either to give to the patient, and it has the information required for them to call and check. So things like the DIN, the name, and they can inquire about their coverage. Or you can even call with them, depending on how busy your pharmacy obviously is. But that's a really helpful resource, I find, to really highlight that things like a health spending account and actual private plans would also cover it in a lot of cases.
And the other question that we had coming in was, how long do you have to wait after Pneumovax? I think we went over that, but maybe we'll do that one.
It is something that's very tricky. I find it takes a few tries. So I do recommend putting the nasty fridge cling up on your fridge that we sent out. It is a sticker and it's a really quick reminder. It's also in one of our Instagram posts, but after your Pneumovax vaccine, you have to wait a full year before receiving a Prevnar vaccine. After you receive your Prevnar vaccine, you only have to wait 8 weeks, so 2 months before receiving your Pneumovax vaccine. And again, ideally, we first want to get Prevnar before you get your Pneumovax vaccine.
Yeah, and a question, what's the approximate price of Prevnar?
If you order it through McMahon, it's $99.91. So it's $100.
Okay, so you get a dime back. You give $100. Okay.
Yeah.
Good.
And we have one question coming in about the participation contest. So as per our last campaigns, we're continuing on with our pizza contest. So any pharmacy who completes their pizza checklist, which was emailed out and is on the partners portal, but let me know if you need another copy and I can always get that to you. But if you put up your signage as part of the campaign, just send in your pictures by Friday, November 22nd, and we'll get you pizza on Friday, November 29th.
Good.
Okay.
We're coming, we promised 7:45, we're at 7:43. We do have time for a couple questions if anybody has anything. Even if you want to talk about flu for a couple minutes, we can do that too. But hopefully about pneumonia.
And while we're waiting for a question, one thing that I've been recommending to people actually is people who have run out of flu shots and aren't able to get any more just yet. One nice offering that you can offer the patient that offers them protection as well would be a pneumonia vaccine. So we know that a lot of patients who first get the flu then end up with pneumonia, and that's one of the serious complications of the flu. So if you don't have the flu vaccine available just yet for them or none in stock, you can say, we don't have that, but we do have pneumonia, which is what we're also trying to protect with the flu shot. And then because they're both not live vaccines, at any point after getting their Prevnar vaccine, they could get their flu shot once it becomes available at your pharmacy again.
Okay. Well, I think that's a wrap, everybody. I'll make one last call out for questions, but seeing that none are coming in, Tiana, I think we must have answered everybody's questions.
We just covered everything.
So like I said, everybody, this is really important to our banner. I think it's important to our partner, Pfizer. We did a great job last year, and I'm pretty confident that we can do even better this year. So I encourage everybody to be active with your pharmacy staff. If you haven't opened the material yet, please do.
It's great material. Like it's very, it looks great in your pharmacy. It looks great stapled onto a bag. It looks great on your pharmacy counter. So all of the above. And I think with that, we'll say, we'll bid everybody adieu for the evening. Thanks for tuning in. We really appreciate it. And have a good rest of your evening, everyone. Good night.
Thank you.